Hello everyone, David Wilson here from Dr. Stem Cells, and in today's video we are going to be going through a paper. This is something I've been looking forward to for quite some time. This is the American Academy of Orthopedic Surgeons Platelet-Rich Plasma for Knee Osteoarthritis Technology Review. As you can see, it's an overview and it's done in the form of a systematic review. So if we go down here a little bit, they assess the literature that addresses the following question: when patients are treated for osteoarthritis of the knee using PRP, are the outcomes of the treatment different from the comparison group? So placebo, no treatment, or alternative treatment. And of course, in today's video, we are going to talk about this paragraph here: summary of findings, PRP versus placebo. Some would tell you there is no evidence for PRP. I think we can see that cannot be correct. And in this case, they've actually read the journal articles, they've went through them, they've looked at the quality of the evidence, and they've only included for PRP versus placebo high and moderate quality. So they've 8 high quality studies which are included. Those are listed just here, this line, and 1 moderate quality study evaluating PRP versus placebo with saline injection. Now that's a 0.9% normal saline, very standard placebo treatment. So let's look at in general. In general, PRP showed an improvement in patient-reported outcomes, and you can see here that total WOMAC scores were improved in all 6 high-quality studies which looked at WOMAC. And then there are the VAS scores. Now, as you know, VAS, Visual Analog Scale, is a less, it's kind of a more generalized, more coarse look at pain. So that's your 0 to 10 scale, whereas WOMAC is very much a decided questionnaire. It helps people direct them to hip and knee problems. Now, I'll have a WOMAC form linked underneath, or I'll maybe even edit it in here so you can see very briefly just what's on it, and then we'll move on. So as we look at the study, they discovered that then, in summary, let's go down to this line here because the summary will then be the most important, but PRP was not found to have any significant effect on cartilage thickness in these studies or in knee strength. And that is correct. The reason for that is because PRP really is, as we've talked about before in some of our other videos, the PRP, the platelets, they're part of the healing cascade and they stimulate healing. And with PRP, you're concentrating platelets up, so you're giving a higher dose of platelets. The body then responds to what's perceived as a larger injury with a larger anti-inflammatory and more healing afterwards. As time passes, the inflammation around the joint, the pain generators tend to get less inflamed. They tend to be there tends to be an improvement in joint function and in patient-reported scores, but you're actually not going to grow new cartilage using a PRP simply because the PRP itself doesn't contain any of the building blocks necessary for growth. It's dependent on response from your body otherwise. PRP compared to saline placebo treatment resulted in improved patient-reported outcomes, which I think is very important because that is really very directly linked to your patient satisfaction score. And the primary improvements noted for questions related to pain and stiffness reports rather than reports of functional improvement. Now again, that makes a certain amount of sense. A PRP, which gives you anti-inflammatory effects, might improve your function somewhat, but it's not going to give you the across-the-board function improvement that you would get if you could replace or improve the cartilage surface and structure. There were no evidence of cartilage structural improvements or improvements in knee strength in the single study addressing these hypotheses. Moreover, the available studies documented rather small cohorts of patients. This is also a very important point. We would love to have big studies with hundreds to thousands of patients in every study, but as I'm sure many of you who are watching this video are aware, PRP studies are generally speaking self-funded because PRP is absolutely antithetical to the pharmaceutical industry. This is going to take patients away from the 1 tablet every day for the rest of your life model and probably get them over to a periodic injection based on their own blood, which means you can't market and sell that. You can't bottle someone else's PRP and give it to another patient. It has to be autologous, is both my opinion and the general consensus. Products were used and results present large variability. The reason for this is also because there's a lot of discussion and a lot of disagreement within the scientific community and within the medical community about what is PRP, and some people think PRP is only when you have 5 to 7 times concentrated up from the patient's own blood. Others say that PRP is everything from 2 times, and this means that there's a lot of variability because one doctor can be giving a PRP based on a machine that produces a 2x concentrate. In fact, I know of some machines that produce less than that. They produce a 1.6 to 2.4x concentrate, and then they wonder why the results aren't as good as others who may be using a more generic approach and making their own PRP. The literature research reported results which seem overall in favour of PRP. Each product remains weakly supported by heterogeneous data on small patient cohorts. More studies and larger patient groups are advised to confirm these findings and identify optimal preparation and patient population for treatment. 100% agree with this. This is key to having a good result later. So we're really hoping that in the future we're going to see more and more studies, more and more high quality studies, and we're hopefully going to have people able to give a standardized dose, so the same dose for every patient. In other words, maybe a 7x concentrate is what I currently think would be the best approach. So we're going to do another video later on. Some of you may have sneaked a peek to the next paragraph down. We'll be doing another video on hyaluronic acid against PRP. We're then going to talk about corticosteroids against PRP, exercise against PRP, look at all the different paragraphs here. Of course, you can download this paper and look at it yourself, but we'll be doing this video series. And if you have any questions, drop them underneath and we'll get back to you as soon as we can. All right, I hope you learned something. I hope this was enjoyable for you, and I'll see you in the next one.